it gives me great pleasure to introduce again Dr. Dick Wenzel, the emeritus chairman of medicine for VCU. Dick is an expert at epidemiology and has a number of really important insights that are very relevant to preventing the spread of this disease. So Dick, thank you for being on, and I'm going to open up the slides. He's first going to talk about something that shouldn't be controversial, but is, and that is the use of face masks.
Well, thank you, Fred. It's a pleasure to be here. I think the value of face masks is really preeminent if we're going to get our arms around controlling this. So I want to go over some data. And in the United States, if you look to the left, 15 states and the District of Columbia that mandated masks and looked at the reduction of daily COVID-19 growth of cases versus states non-mandating masks. And during the study period, there was actually a dose response. For the longer the use of masks, the lower the rates. And the authors said that in all likelihood, somewhere between 230,000 to 450,000 infections were prevented by those states and areas using masks. Then if you look to the right, internationally, there's been a really interesting meta-analysis of 29 studies that did not, and 10 studies that did adjust for confounders, looking for outcomes. And of those exposed to known SARS or MERS or COVID-19, and any one of the really lethal, if you will, coronaviruses, the risk of transmission by wearing a mask was reduced by 66% to 85% respectively. So we have powerful data that the use of masks really cuts down infections. Next slide. So then a new study that actually came from VCU, independent predictors of per capita mortality from COVID-19, examining 198 countries now, international. So if you look on the left, the worst outcomes were predicted by the duration of infection in the country, the percentage of the population over age 60, and obesity rates in countries. The better outcomes were international travel restrictions were prominent, and the duration of mask wearing. So again, an international study, per capita mortality. It turns out the model explained 46% of the variation across countries. And just to give you an example, what they showed was 99 countries with the lower mortality had 1 death per million versus those with high mortality countries, 94 deaths per million. Remarkable reduction in per capita mortality. Next slide. So this slide actually shows you graphically the same thing with the mortality per capita on the y-axis and the duration of infection in the country on the x-axis. And the title is Independent Predictors of Per Capita Mortality from COVID-19 and of 198 countries. So if you look at the bottom, there's a blue line that actually shows you masks were used in those countries within 15 days of recognition of the infection. It practically stayed at 0 mortality. If you look at the little blip or the somewhat orange, masks were picked up in those countries 16 to 30 days. So not the first 2 weeks, but the second 2 weeks, while you barely got up to somewhere around 10 or so at the most per capita mortality. And then you look at the huge spike all the way up over several hundred, the non-mask countries. So the per capita mortality graphically here says those countries that used masks earlier did much better.